Leukemia patient Bryn Ailinger released by Roswell Park Cancer Center Christmas 2025 is better and brighter for one family whose daughter is on the mend from a previously untreatable form of childhood cancer. Christmas 2024 saw then 5-year-old Bryn Ailinger isolated in a child cancer ward, having been diagnosed with precursor B-cell acute lymphoblastic leukemia, which harbored a rare and aggressive mutation that rendered standard chemotherapies and surgeries ineffective. "You think the worst immediately," said Justin Ailinger, Bryn's father. "I didn't know if I was going to have a daughter by the end of the year." Bryn's care team from the Roswell Park Oishei Children's Pediatric Cancer and Blood Disorders Program then presented the family with the option of the Nobel Prize-winning CAR T-cell cancer therapy as an option. Leukemia may have cost Bryn one Christmas, but thanks to this program she gained many, many more. "I look at her, and I see a miracle," said Megan Hickman, MD. PhD, a pediatric oncologist at Roswell Park specializing in blood cancers. "That's because this kid 5 years ago wouldn't have been alive, and now she's alive, thriving, and just wow." Dr. Hickman and her Roswell Park colleagues recommend CAR T-cell therapy even for their youngest patients who can benefit not only for its efficacy, but also its safety compared to chemo. "Chemotherapy is so toxic," said Ajay Gupta, also a pediatric oncologist at Roswell Park. "We're trying to make it so that patients have a better quality of life even after they are done with treatment. And so I feel strongly that approaches that can change the immune system, like CAR T-cells, can actually do this without causing long-term side effects." Bryn Ailinger enjoying Christmas, as all children should. Credits supplied by Roswell Park Oishei Children's Hospital. CAR T-cell therapy involves extracting T-cells, a type of immune cell, from a patient's blood, and then taking them into a specialized lab. From there, scientists engineer the cells to recognize and kill cancer cells. The cells are then duplicated by the millions and replaced in the patient's body through aroma for infusion. The cells are processed in Roswell Park's newly expanded Good Manufacturing Practice Engineering Cell Manufacturing Facility, GEM, one of the largest facilities of its kind in the United States, and a transformative advancement in cancer research and treatment. I hope for other children that have this mutation pop up that they are able to collaborate with Dr. Hickman and the others and try these same therapies that were successful for Bryn, Ailinger said. "I hope that she's able to help save lives for other children as well that go through this." Other miracle cancer treatments, incredibly encouraging drug trial shrinks tumors in head and neck cancer patients. Within 6 weeks, the results of CAR T-cell therapy so far have been highly promising, with acute leukemia remaining undetectable in more than 80% of patients following their treatment. As of now, CAR T-cell therapy is FDA approved only for certain types of blood cancer, but Roswell Park is also working to expand the use of the treatment against other cancers from rare types like sarcoma to the second most common cancer in kids, brain tumors. Get inspired, a 9-year-old son saves his father from leukemia by donating stem cells. "Our next job is how can we get them into more solid tumors or into places that it's hard to get to because the immune system doesn't really get there as well as it should," Hickman said. "Like the brain, chemo often doesn't get there because of the way that the blood-brain barrier works. So what we really need to do is build more things to keep it around for everybody."